let's now talk about the sinuses. We'll use a blue highlighter to fill in where there is venous blood returning to the circulation. One of those main places is the superior sagittal sinus. It reabsorbs the CSF from the arachnoid villi. And that's not the only place that reabsorption can happen. It can also happen in other sinuses. I'm actually not even going to show you all of them. There are a couple others that I'm leaving off. But let's look at the transverse sinuses that separate the cerebrum and the cerebellum. These also are filled with blood. And it's venous blood, meaning it's deoxygenated. It's already provided oxygen and its nutrients to the tissues of the brain, and now it's being collected and heading back down the head, and where it will all join up into the jugular veins that will pass out of the skull and go down your neck and then return to the heart. Then they get pumped to the lungs and then it gets reoxygenated again. So these are the transverse sinuses. Now let's look at a separation between the two sides of the cerebral hemispheres, and it's a layer of the dura mater. So I'm going to use my purple pen. Actually, this would, if you take your highlighter, you might kind of join this up a little bit more through here, because it's a layer of the dura mater that has a special name called the Falx Cerebri. So the section of dura mater that separates the right and left cerebral hemispheres is called the Falx Cerebri. So notice that is dura mater. It just is given a special name there called the Falx Cerebri. And one thing that will come up this quarter that's pretty cool, when you look in the skull, when you're dissecting or when you're learning the parts of the brain or in the bones of the skull, you'll see this protrusion in the cranium called the crista galli, and it's this little bumpy part of the bone that the bottom of the dura mater here actually can attach to within the skull, up near, like above your eyes. Okay, now let's look at hematomas. So first of all, there could be a hematoma in which the dura mater literally is pulled away from the bone. So the bone is in black. This would be just the skull. And then, of course, we know that this is the dura mater right here. So see how something happened that separated these. Well, what could happen is a rip or a damage of the meningeal artery. So we're going to use pink right here, because this would be arterial blood. Arterial blood in the brain is oxygenated. So this could be a pretty serious brain bleed. So we call this an epidural hematoma. Epidural because it's upon the dura. Now, right away, I know that when you hear epidural, you think of the anesthesia that a woman gets when she's having a baby, or maybe an epidural cortisone injection. In the spinal cord, there is a natural separation between the dura mater and the bones of the vertebrae, and so medicine, anesthesia, can be injected there. In the brain, there should not be an epidural space. The dura mater adheres to the bone, see? But if an artery is damaged or bursts or something, then you can get this as the bleeding out presses the dura mater against the brain. So it's usually arterial blood from a meningeal artery. Now, my understanding of the clinical presentation of an epidural hematoma is that it might not show symptoms for a little while, and then all of a sudden the patient goes downhill really fast. They lose consciousness and might have like a fixed pupil or something. So it can be a sudden onset of the symptoms. And I want you to compare that with my understanding anyway of a subdural hematoma. It's a little bit different. Do you see over here? The subdural hematoma, it's underneath the dura and above the arachnoid. Now, normally, you can see those adhere together pretty tightly. But if there is a bleed somewhere in here, then it can actually fill with venous blood. So we'll use blue again, but this is not meant to be a sinus. It's meant to be the venous blood of a subdural hematoma. This can be the kind of hematoma that occurs in shaken baby syndrome, for example. And the symptoms of a subdural hematoma are, from what I understand, more gradual, and over the course of a few days, the person may become more and more confused as the pressure is damaging or the neuronal tissue.